Hi there, Tracy from Kazadans Equestrian, and this week I'm taking a quick look at splints. What they are, what causes them, what to do with them, and what is the prognosis. What we commonly term splints in the horse is actually an inflammation of the splint bone, and the splint bones are located either side of the cannon bone in the horse. So the splint bone's existence is normal. The inflammation and calcifications of those are not necessarily so. And the normal growth and the normal ossification of these actually really do provide support to the cannon bone and a little bit of strength. So what we call splints are normally caused by inflammation of that connective tissue and the ligament between the splint bone and the cannon, which then ossifies and grows into a bony swelling. So it starts as soft tissue swelling and develops into the bony swelling, which is what you generally feel when you run your hands down your horse's legs, which we all should do before you ride every single time. Splints commonly occur in 2 to 3 year olds, sometimes 4-year-olds. They very rarely come back up again as adults because that bone has already ossified correctly. And developing splints is normally associated with a horse getting too much work for what its legs can handle at that stage. They can also be caused, however, by trauma or injury. So there are 4 types of splints, and this is kind of important to know because some of them can be a little bit more significant for your long-term prognosis than the other types. So what we call a true splint just comes from the swelling of that ligament between the cannon and the splint bone, which eventually causes a bony swelling. This is what we call a true splint. A blind splint is actually a splint that occurs between the splint bone and the suspensory ligament. So you can see this one, and a bone growth here is much more important to the horse and really important to diagnose that this is where the splint is. One of the problems with a blind splint is that they quite often show no external swelling, so you still may get a little bit of pain or feel something in that spot. And maybe a little bit of lameness, but there's very little external swelling due to where this splint is. The third type of splint is basically a response to trauma, inflammation due to trauma, injury, and that's called a periostitis splint. And the fourth type of splint, which is also really important, is what we would call a knee splint. Now, this is where the bony swelling occurs quite high up the splint bone and can actually involve the lower part of the knee joint. So this can be quite significant. So what are the signs of a splint? Swelling, pain, heat, lameness. When the splints are active, they're often quite painful. If you're running your hands down your horse's leg, they might be a bit, adverse to you pushing the sides of their bone. Lameness can be quite difficult to detect sometimes because sometimes the horses don't go very overtly lame. It might be quite mild and it might be very hard to pick up. But if you're going to see splint lameness, it's more likely to show at a trot. So if you think about those different types of splints that your horse can have, you can see that it's actually quite important for you to work out which one this is and get a bit of a diagnosis from your vet. They may want to x-ray, ultrasound, do some kind of scan to see where the activity of your splint is. It's also important that they can rule out something like a fracture of the splint bone. So how do you prevent your horses getting a splint? The 2 real biggies are do not overwork your young horse. They're not ready for it. If anything like this happens, rest them and treat them as not ready for the amount of work that they have been getting. And hoof balance. Hoof balance is critical. You really need the horse to be loading his joints and bones evenly and symmetrically. So a hoof that is out of balance, or a horse that has conformational problems in the front legs like pigeon toes, toeing out, any turn from the knee, even if your horse is very base narrow, meaning that the legs, I guess, come out of the chest wide enough, but towards the ground, they're a lot closer together. This can also cause uneven pressure on those cannon bones and really help splints develop. And obviously, if you suspect a splint, please get your vet to have a look at it so that you can determine which type of splint this is. So if your horse does have a splint, what is the best kind of treatment? Well, reality is rest. Rest, rest, and rest is the best thing to do. So again, even if you feel like you haven't been working your young horse too much, but it has developed splints and it's too much for that horse, give it some rest. And ice and cold therapy, anything that creates an anti-inflammatory response is what we want. We want to reduce the inflammation in that splint area as much as possible. Obviously, your vet will help make a decision whether you need any anti-inflammatories, but you can also just offer a bit of a support bandage. You know, it can be tricky, you don't want the bandage too tight, but just really the sort of thing that you would do if you had an inflammation to help reduce the swelling. So after all that, if your horse does get a splint, please don't panic. The prognosis is really quite good for horses getting back to normal activity. The difference is, of course, if you have one of these splints that has grown big enough and is constantly rubbing on the suspensory ligament. This is really important. And also, if the bony growth gets large and starts interfering with the knee joint in a knee splint, that too doesn't quite have a great prognosis. So it is really important for you to work out where that splint is and where the activity is. Hopefully this has been really helpful for you. Please don't forget to subscribe to my channel. Click on that notification bell so that you get notified when I release next week's video, and I'll see you then.